Bonjour, bonjour, mes amis. It is delightful to see you here for a third evening. And Dr. Varden, it makes me even more delighted to introduce you and welcome you to a triple header. It is so good to see you again. How are you today, Midel?
I am doing quite well. Yes, our dynamic duo here going for that triple header.
I
Absolutely.
all the sports terms, and you're actually athletic though, so you get to use
Oh, yeah.
them. I just pretend to use them.
Love the sports.
And audience, it is so good to have you here with us this evening. Dr. Varden and I were prepping and we're really excited for some of the tips and tricks that we can offer, but also especially some of the teasing out that we're going to do around what exactly anxiety is and approaches that might be very appropriate to you based on what you have and based on your genes. Um, and so, audience, I'd love to know where you're calling in from this evening. I think I got out of the habit of asking you. And my goal, audience, if we don't know this already, and Dr. Varden, I know you're party to this goal too. We had someone once call in from a boat. And so I'm really, really, really hoping one day someone will be like, I'm calling in from a plane or a balloon or something delightful. So, audience, let us know where you're calling in from, especially if it's not from the comfort of your own home or office. Yeah. So, oh, New Jersey. That's fun. I like it.
I actually I I like how Robin put in apprehensive about apps. That is cute.
Very cute. We're all over the US this evening.
Oh, yes.
Yeah.
We're out of
And
Georgia,
our boat
Boston.
friend is still calling in from the boat. So thank you, boat friend. We're really, really grateful for you here this evening. Yeah. All right. So, Dr. Varden, why don't we kick things off a little bit by first off talking about the anxiety epidemic. Let's put some numbers to this before we kind of tease out what exactly is going on, because there's definitely been an uptick in anxiety. So let's
Mhm.
understand that what exactly is happening around the world.
Absolutely. I mean, it it really gets very disconcerting and sad in a way to see stats and
Hmm.
hear about all the people dealing with anxiety and mental health issues and how that uptick has
Yeah.
been. And you tend to wonder, is this because people are voicing or
Hmm.
letting it be known that they are dealing with these things more so than they used to? Or is it because of global situations, that
Yeah.
happen to all of us, that there has been recorded information about, anxiety being increased? But one of the major stats
Yeah.
is that the World Health Organization has said that there are over 301 million people
Yeah.
worldwide living with an anxiety disorder as of 2019. So
So,
this is before the pandemic and the world shut down.
yeah. Yep. Yep.
It's
Yeah. And if you look at the before and after, so I want to acknowledge these numbers aren't recent in the 2025 sense, but they are recent.
Mhm.
Before, so what Dr. Varden just mentioned, 2019. If we look to the US specifically, there was approximately 11% of US adults that were either experiencing a full-blown version, like a diagnosed version of anxiety, or anxious symptoms. They kind of lump them together because if you're going through a period of anxiety, it kind of feels fully like a full-blown diagnosis, right? And then if you compare that to 2 years, 3 years later, so just after the pandemic, so 2021, those numbers rose from about 11% up to 30%, a little bit over 30%.
Mhm.
So the experience of anxiety simply based on that world event, and Robin's making a comment to us that audience you can't see, based on everything that's going on in the world, everything that we can see between politics and war, it makes sense that this is almost a natural response, right?
Mhm.
Yeah.
Yeah. And I mean, also some recent trends about young adults. So here we are
Mm,
talking ages like 18 to 29. I mean, we're not even
yeah.
in the teenagers because that was a whole other thing. But
Yep.
between 18 and 29 years old, they have the highest rates with
Yep.
nearly 50% reporting symptoms of anxiety in some
Yeah.
surveys.
Yeah.
I mean, I get this rush feeling of going, oh my gosh, I
Yeah.
have two babies downstairs,
Yeah.
to think that one of them
Yeah.
could have
Yeah.
that, or could, you know, report symptoms, of having that at some point. That's
Yeah. Yeah, yeah. And I think this evening audience, what Dr. Varden and I are going to endeavor to do is we want to tease apart when people, especially in the pop media, talk about anxiety, or when you mention anxiety to a friend, we really want to tease that apart from a clinical perspective, really speak
mm,
to the anxiety, the psychological condition, and separate and apart from that, um, a nervous system kind of overactivation that
mhm,
many times that we hear about when people say anxiety, they're kind of talking about both of those things, even though they're distinct things. So tonight we're going to tease that apart, especially the nervous system compared to the psychological experience of anxiety. And we're going to talk about how genes play into that. And especially through that conversation of how do genes play into it, that can really personalize how you might want to be approaching either your anxiety or separate to that, some of your stress management, things that might not necessarily bring on a full blown diagnosed anxiety, but that symptom picture, that feeling, that transitory feeling of anxiety. Yeah. And I think just Dr. Varden, on the note of kind of worrying about worrying, good use of words for anxiety, but the idea of being concerned about younger people, in this instance of anxiety, one thing that gives me hope, and I've seen this change over the 10 years of my clinical practice, so this gives me a lot of hope, is the words, the awareness, and the willingness of people to address this
mhm.
is increasing, and of consequence to that, the amount of people getting specific help to what's going on in them is increasing, right? I see young people, in particular young men, that walk into my office and they have words for their feelings, which I've never seen that before, which I think is so powerful. So, yes, while these rates are going up, we're also seeing this beautiful resilience within younger populations of, cool, this might be happening to me, but I'm willing to talk about it and willing to do something about it, which I think is so powerful and exciting. Yeah.
I wanted to mention, because we've had such wonderful comments, not only from
Mhm.
where people are calling in from, or where they are hailing
Yeah.
from, for this webinar, but also some other great comments
Yeah.
that I'm noticing that they are only two hosts and panelists. So I
Mhm.
encourage our audience, if you want other audience members to see your comments,
Oh,
please make sure, or we can't, or
no, no, our webinar is right now set up where just we receive these comments.
oh, gotcha.
Yeah.
Okay. Sorry, my
No,
misunderstanding.
all good, all good, all good. It's of consequence, audience. This is for your own protection. We've had instances where people have offered up really personal information, and we don't want the whole world to accidentally have access to that. So and unfortunately, it's just myself and Dr. Varden and Vanny, who works behind the scenes, who is able to see this. But we'll make sure anytime we're commenting on something you say, we'll echo it back. But I value the community spirit because I think the community spirit's important, especially when we're talking about anxiety.
Thank you.
Yeah.
Sorry about that.
No, 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 nothing to apologize for. All right, audience, we're going to jump into it. So, the first thing that Dr. Varden and I want to talk about is making sure we're drawing a distinct difference between anxiety, the clinical psychological condition, and separate to that, an overactive sympathetic nervous system. All right. Because oftentimes, and I think even a little bit within the titling of this webinar, people think they're the same thing and they can co-occur, but they're different things and they can be treated differently. And this is why, audience, it's really important for you to understand. So, Dr. Varden, which would you like to start with?
Hmm. You know what? Uh, why don't we just start with anxiety? Because
Yeah,
that's the main
perfect.
title. That's what we're
Love it.
looking at. So let's start there. I think
Yeah.
that would be good.
Yeah. So, to a core definition of what exactly anxiety is, it is a psychological state that is characterized by excessive worry, excessive fear, and apprehension to the end where this is life disruptive. So, this is the first difference to draw, right? You can definitely have anxious feelings, but if those are a little bit more transitory and not life disruptive, right, there's an element of it's not kind of categorized there. There's several diagnostic tools and that can go through thought patterns that really support the diagnosis. And I want to be clear, this is not to say that anxiety is only in the head, right? It very much can manifest within the body. You know, it can shift heart rate. It can, for example, some people will have panic attacks that are closely associated with anxiety and it feels like a heart attack, right? So it will absolutely manifest within the body. But the hallmark, that clinical element of anxiety is this thought pattern, the catastrophizing, the worry, the apprehension, the inability to act within life of consequence to some of the ruminative thought patterns that are happening. Okay. And this is in difference to Dr. Varden. Do you want to talk about the sympathetic nervous system overactivation?
Yes. So sympathetic nervous system, oftentimes we will say SNS. So, if we condense and shorten that, that's what we're talking about. The sympathetic, okay, that fight or flight state as compared to parasympathetic, which is your rest and digest. Okay. So when you have sympathetic nervous system overactivation, this is more of a physiological state.
Mm-hmm.
This is where that sympathetic branch of the autonomic nervous system, it dominates. So it drives that fight or flight response.
Mm-hmm.
And, when we are looking at this, it can be subconscious or purely body, that the nervous system is just like overactive, like
Mm-hmm.
a toddler.
Yeah.
So
And so
go
what
ahead.
let's talk about that. So when the nervous system goes into fight or flight mode, once upon a time this was very adaptive. Once upon a time, if you saw a tiger, you wanted your nervous system to go into overdrive so that you could scoot away from that tiger. The
Right.
thing is, though, nowadays this is not adaptive. And so what happens when your nervous system goes into overdrive? First of all, you're going to get a flooding of sugar to the system because your muscles need energy to run away or to fight or to freeze, whatever that might be. Okay. The next thing that's going to happen is your heart rate's going to raise because you want to start pumping that blood, getting that sugar out there, getting that oxygen out there, and it will also quite literally shift where brain resources are. Right. You tend to in the moment lose a little bit of like your vision will change. It will go from kind of wide and peripheral to very focused to what's before you. And then from a brain perspective, not necessarily the best thinking because there's an element of panic and what do I do really quickly to survive, right? Kind of going a little bit back to that lizard brain. Okay. And so this can in some people will identify as feelings of anxiety, right? If your heart rate is raising, you feel a little bit clammy, like it will. Oh, mon Dieu, excuse me. It'll change the temperature of skin, right? It will change some of uh, the way your brain is working, and that can absolutely feel like anxiety. But remember, we're really talking body based here. We're not talking about thought patterns, kind of catastrophic sort of things that are going on in mind, right? Dr. Varden, did I miss anything there? You're good at articulating.
Well, it can also increase the breathing, the
Hmm.
rate of breath.
Hmm.
Okay, because
Yeah.
with that increased heart rate and
Hmm.
blood pressure,
Yeah.
you had mentioned about the sweating,
Hmm.
pupil dilation.
Yeah.
Also because you are in that sympathetic state. Remember, I said opposite to parasympathetic, which is rest and digest.
Hmm.
Digestion is
Hmm.
suppressed.
Yeah.
Okay. So it's like nothing else matters. it's you either fight the tiger or you run away from it.
Yeah. Yeah.
So
Yeah.
and oftentimes people will have these types of reactions in public speaking. I remember a
Hmm.
lot of my students,
Yeah.
when they had to get up and do their presentations, they were going through all of
Hmm.
these physiological, things, these characteristics. And, it can it can be rather scary too.
Absolutely. And I would offer, like, I mean, the convenient word for it, it can be a feeling of anxiety because with all these senses heightened and that rush of sugar,
Right.
right? That's how your body's interpreting it. And so, audience, why are we pausing here to make sure we're teasing this out? Okay.
Mhm.
If you have either condition, anxiety or sympathetic overdrive, there is a lot of diet and lifestyle things that can be done to support you. And the overlap of kind of that treatment from a diet and lifestyle perspective is quite extensive, right? There's a lot you can do with diet. There's a lot you can do with meditation. There's a lot that you can do with sugar regulation. There's a lot you can do with breathing exercises to support. But if you are someone with true clinical anxiety, that overthinking picture, that worry, that rumination picture, there needs to be additional support offered insofar as psychological counseling. Okay. So, tonight we're really going to talk a lot about the genes that impact both. We're going to talk about the diet and lifestyle that impact both. But it's really, really important that if you sit on that side of kind of this anxiety spectrum that includes a lot of the thought patterns, you need to be working with a professional to consider therapy and or medication and or other things to ensure you're resolving it, because diet and lifestyle alone, should there be a clinical presentation of anxiety, will rarely address it all. Yeah. Fair? Fair, Dr.
That,
Varden?
yeah, that's
Yeah.
very fair. And
Yeah.
I'm sure we'll be adding in more
Hmm.
information about the nuances between the two and understanding or being able to recognize,
Yeah.
what am I personally dealing with, or
Yeah.
family member, a friend, or being able to recognize that. Because I'll tell you, education, awareness is
Yeah.
really key. And I love how you had said earlier about clients, patients coming in and having better language around it.
Yeah.
That is so important, to be able to express and verbalize the feelings, the emotions, teasing out yourself
Yeah.
what's going on inside your body, what you are feeling, and being able to connect them.
Yeah. 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 And I think it's very important too, because sometimes um especially if it's simply, I don't mean this dismissively, but if it's something that is a nervous system overactivation, it's not that anxiety picture. And yet you think it's anxiety and you're trying to address it with tools that are very specific to anxiety, you're missing the underlying cause, what is pushing you into that overdrive. For some people, this can be secondary to gut dysbiosis. For some people, this can be secondary to POTS or other consequences of things like long haul COVID or post viral reactivation. There's many different things that can kind of set the nervous system off. And so making sure you're able to discern by the two, between the two. And honestly, audience, if you're struggling to discern, reach out to us. We'll support you. We'll set you up with someone that can help with that process. But it's really important because the treatments for those, especially the underlying causes, will be different. Yeah.
And I want to remind our audience, I'm seeing some great questions in the chat, but if you could
Hmm.
please copy and paste them over to our Q&A, because we don't want them to get
Hmm.
lost.
Yeah.
So yeah, if you haven't already, please put
Hmm.
those beautiful questions from the chat into our Q&A. Thank
Yeah.
you.
All right. Sweetness. So, Dr. Varden, why don't we transition a little bit into the genes that can really influence a presentation? I'm going to be honest, they kind of can influence a presentation of anxiety and or a presentation of sympathetic overdrive. And audience, just as a disclaimer before we jump into these genes, as with everything that is delightful and joyful in life, there's not going to be a singular gene that is like you do or do not have anxiety. It is a strong constellation. It's a strong smorgasbord of genes that will play into it. And so we're really going to highlight a few that can lend both to anxiety, but separate to that sympathetic nervous system overactivation, and how knowing your presentation there can really shift how you're approaching what's going on, as well as taking away some of the blame. You know, your overactive thinking is not necessarily your moral failing in life. It's just simply a quirk of your genes. And now that we know that, we can work with it differently. Yeah. So, Dr. Varden, do you want to start with genes that perhaps influence serotonin? That would be my guess. Or do you want to start with COMT? Dealer's choice.
Actually,
Ooh,
let's go with serotonin, like you were talking
love
about,
it.
because that will actually work into the clearance
Yeah.
thereof, that neurotransmitter. So
Yes.
first,
Yes.
let's talk about transport, and that would be our
Mhm.
5-HTT-LPR gene. So with the 5-HTT-LPR, this gene actually is the transporter of serotonin. So when you have your nerves in the nervous system, okay, you've got, and I've talked about this using my hands. So you have the end axon of the nerve, and it will release neurotransmitters. And then there's this space called the synaptic
Mhm.
cleft, okay, that these neurotransmitters are floating around, and then they bind to the receptors on the receiving nerve, okay? And part of 5-HTT-LPR gene is the transport for uh, returning the serotonin for reprocessing. How well does that happen? And then, of course, we also have the clearance when we're talking about COMT and MAO, which we'll jump into. So now the thing with the 5-HTT-LPR is you will see, by the way, you will find all of these genes that we're talking about in your mood and behavior reports of your DNA 360 reports. Okay.
Mhm.
So, if you're going, oh, where is this? That's where you'll find it.
Mhm.
So, um, as I was saying, with the 5-HTT-LPR, we are looking at that serotonin reuptake. Okay, so you're going to see either an LL, an LS, or an SS. So it's not a single nucleotide polymorphism. Okay, this actually looks at the length of which this gene is. Okay, so
Mhm.
the L is for long, S is for short. The L is I don't want to say normal because it's not
It's
it's not
long.
like that. It kind of like a wild type, okay? Because there really isn't a good or bad per se. It's all in the
Mhm.
context, really. And I know I've said this before, but it's even more so in the mood and behavior, because
Yeah.
the beautiful combinations are partly what give each of us our own uniqueness. And these combinations can either be can be problematic, or they can be superpowers, again,
Yeah.
based on the context. So,
Mhm.
but the S allele, okay, because we said the long was more of
Mhm.
um, the wild type, okay, so the S would be more of the mutation, in that gene length, and it can relate to increased anxiety, stress, cortisol
Yeah.
response. It can exaggerate the that SNS, okay, the
Mhm.
sympathetic nervous system response
Mhm.
to stress.
Yeah.
Okay, so there's some correlation between it. Would you like to
Yeah.
add a little bit more to that?
Yeah, audience. So as Dr. Varden alluded to again, it really speaks to once serotonin is tossed out into the cleft. Now, think about serotonin. I think most people have heard of serotonin in kind of the 1970s and 80s version, in the sense of it's the thing that makes you happy. And if you have enough, you're going to be happy. And if you do not have enough, then you're going to be sad. And if you're sad, we can give you something that'll increase your serotonin. You'll be fine. Right. And the 1990s and 2000s came along and we're like, oops, guess that's not right. But it is part of the story. And so I want you to start thinking of serotonin not as your happy neurotransmitter, but instead of as the neurotransmitter that gives you a hug and makes you feel calm. Right. So you have a rough day, you go to your mama and mama gives you a hug, and then you're like, oh, okay. And body experiences a little bit of that release. That is what serotonin does. It doesn't make you happy, it actually gives you a sense of calm. So, in the absence of that, as Dr. Varden mentioned, in the absence of that, people are more prone to one or both, either anxiety or a little bit of an agitated nervous system, because at baseline, they don't necessarily have that sense of calm. Okay. And this will influence, we're not going to dive into it too deeply here, but this promoter region, this region that really supports how serotonin is managed within the clef, okay, um, it can influence medication someone might be taking for anxiety. So if you are oftentimes, if you're sitting there with a moderate to severe case of anxiety, medication might be an appropriate intervention for you. And so I'd really encourage, if you're sitting in that space, if you're considering a pharmaceutical intervention, ensure that you get something called a PGX test, which is a pharmacogenomic test, which will look at this and many other genes that we know interact with psychological or mood altering agents. And I think that's really, really important because we have this incredible insight that based on how your genes interact with drugs, it might influence that. And the 5-HTT-LPR promoter region is part of that. But this isn't a PGX conversation. So just know that technology exists. It's something we offer, and it's something you might want to consider if you're kind of sitting in that more severe space and considering different agents. So in summary, serotonin is a hug. If you have a short presentation, so either an LS or an SS, you're not getting that hug after that stressful moment. And so it's a little bit more difficult for you to calm down. And that can beget either anxiety or kind of that more tenuous nervous system presentation. Yeah. Any other thoughts there? Did I miss anything? Oh, that's a yes.
Yeah, we missed the poll.
Oh, Lord, of course we did. Of course we
I'm
did.
looking at the time. I'm like, oh my goodness, we gotta get to the poll.
So,
Not to mention this beautiful nudge.
audience, a quick aside, and no, I think this showcases a 5-HTP beautifully. So you know how Dr. Varden said, there's good and bad to it. So if you have long, there's a little bit more of a sense of calm that you can have, and you kind of can see the bigger picture because you're chilling. And amazingly, I'm a happy LL. I got it all. I'm happy on my cloud nine. Dr. Varden, in stark contrast, she's a double S, and so a little bit less access to that. But her superpower audience, she knows all the details. She's on top of all the little things because that lesser serotonin picture encourages, enables more of a broad sense of multitasking, for lack of better phrasing, and exquisite attention to detail. So Dr. Varden keeps me on point, and I value her for it so, so very much because I'm sitting on my calm cloud.
Yeah, but I can get distracted easily too.
Touche. So, audience, for the poll that we're talking about here, Dr. Varden and I show up to the end of supporting your understanding of what you want to know. So, we always encourage a poll so that we know why you showed up today and how to ensure that we can speak to it, even though right now it's late better than never. The first question we asked: how would you describe your current experience with anxiety? And about 40% of our audience is saying that they experience moderate and consistent anxiety, right? Another 42% is saying they experience it quite occasionally. And so really this does unfortunately speak to the numbers that we talked about that across the world and across the US. So thank you for being here with us this evening. I hope that we, over the course of the evening, share something that shifts that experience. And if we don't hesitate to reach out for more individualized help. We want to be there for you. And we're grateful that you're here with us this evening. The next question that we asked, have you explored the genetic components of it? About 60% say they have their genes tested. I'm grateful. Hopefully, if it is with us, you have your report out so you can really enliven some of this. Okay. And then about 10% of the audience, or 30% if we aggregate, has either not heard of it or doesn't really know the connection. So hopefully, especially given the few genes we've talked about already, you're starting to see some of that connection there. The next question we ask is, do you currently take medication? There's I guess, 9%, 10% of our audience is saying both medication and supplements. About 30% of our audience is saying supplements. And then 60% of our audience is saying none. And so excuse me, hopefully by the end of this, in particular for that crowd that really speaks to the difference between anxiety and a nervous system activation, we can help you tease out differences there and what you might want to consider with your healthcare provider. The last question that we have here is, what do you hope to gain from the webinar? Um, Majority, 36%, obviously are saying want to know what's up with the genes. So we'll continue on with that conversation. And then the next grouping here is asking for practical steps to reduce anxiety. So we'll continue on with some of that stuff too. All right, Dr. Arden.
All right. You
Shall
want to go
we?
back to genes and
Let's
see that
let's
that
go
was
back.
number one, talking about the genes. And
Yeah.
actually, it might give you a beat to take a glass, a sip of water.
Yes, ma'am. Thank you. All right, Madel, jump into your next.
Mhm. Okay, so seeing that we were talking about a gene that regulates serotonin transport, let's talk about a gene that helps to degrade and clear serotonin, and that would be the MAO gene, monoamine oxidase, specifically MAOA. And again, like I said, it helps to degrade serotonin as well as other neurotransmitters like dopamine, norepinephrine. And when this particular gene, that enzymatic activity, okay, to help clear, when that is altered, meaning that it has reduced functionality. For example, the G allele has faster activity of clearance. The T allele has slower activity or lower. So you will either look at or have a GG presentation, which means you're fast at the clearance, a GT, which is more of an average or moderate clearance, or a TT, which is a slow clearance. Okay. And when you have a slow clearance, that leads to higher neurotransmitter levels because they're hanging out, around that synaptic cleft longer, and
Mhm.
obviously faster, that means it clears very quickly.
Mhm.
So, how does this impact anxiety? Well, when you have that T allele, okay, slower, and therefore you have more of the neurotransmitters hanging around, that can increase anxiety, aggression, the
Mhm.
stress reactivity, likely due to the excessive neurotransmitter
Yeah.
stimulation. So, conversely, faster removal can blunt emotional responses, but may also be linked to depression.
Mhm.
So, it is nuanced, but
Yeah.
again, it's just one gene. Now,
Yeah.
how
Yeah.
can it work into the SNS overactivation? Well, when we're talking about imbalances in neurotransmitter breakdown, this can dysregulate the autonomic response. That can make individuals more prone to the sympathetic nervous system overactivation and stress related symptoms.
Mhm.
So,
Yeah.
is
Yeah.
that MAO?
Yeah, and I think that's a good segue into COMT, and COMT being a gene that is so well studied for how do we clear stuff out of the brain, so
Yeah.
much so that there's a moniker associated with it. Before though we jump into COMT, I just want to respond to a comment from the audience, and I'm not going to use this person's name. There's a member of the audience that has said, "Hey, I have some questions that I'd really like to ask, but I'm nervous about my name being said or personal identifying information being offered." So if you do have a question, first of all, thank you for trusting us with it. Please ensure it does go into the Q&A box just so that we can get to it at the end. And if you would like it to be a very anonymous question, we don't use your name and maybe we drop some details to really ensure there's privacy there. Please ensure that you do state that in the question so that we because we want to be personal. I was going to say we want to be friends with you, but we really want to be engaged with you. We're happy to use names because we want to create that connection with you. But if there's something in the question that you don't want any of your identity associated with, make sure you clearly state that in the question so that we don't. And I appreciate that mental health especially is one of those spaces that we want a little bit of arm's length from. Yeah. So why don't we back to the genes?
Mhm.
Dr. Varden, COMT, one of the most heavily studied genes when it comes to mental health in particular. Yeah. Do you want to jump into our Worrier versus Worrier?
Absolutely.
Yeah.
Okay, so COMT. This stands for catechol O methyltransferase. There we go. Yay. So it's COMT and it metabolizes catecholamines. And these
Hmm.
include dopamine, norepinephrine, epinephrine, especially in the prefrontal cortex.
That's where
So
you think.
executive functioning, all right,
Hmm.
MAO, it actually deals more with the peripheral. And so when you're talking about different polymorphisms, so the different letters that you can have. So for COMT, you're either going to see a GG, a GA, or an AA. Now the GG is fast, okay? Fast clearance, higher activity, faster breakdown of these catecholamines, potentially causing lower dopamine levels, okay? Um, if you have if you are AA, okay, slower clearance, slower breakdown, you can have higher levels of dopamine, norepinephrine levels, so they hang
Hmm.
out longer. So
Yeah.
how does this impact, say, anxiety? Okay, so when we're talking about anxiety, the slower removal that has been linked to increased anxiety, stress sensitivity, and emotional
Hmm.
activity due to higher catecholamine levels, higher
Yeah.
adrenaline. Okay, adrenaline is given when you have that like excitation.
Hmm.
Like if you get scared. If I mean
Kicks
that's that
off that
rush.
nervous system.
Oh,
Yeah.
yeah, it gives you that initial rush.
Yeah.
But you don't want to stay in that state. And if
Hmm.
it's hanging around, and if the binding, which we'll get into as well, which is the F2B as a spoiler alert, if that receptor is not releasing
Yeah.
that neurotransmitter, it keeps you in that state of stress,
Hmm.
which can be even more deleterious in the way that you're feeling. But
Yeah.
individuals with that variant may experience that heightened arousal, like I was saying, slower
Mhm.
recovery from stress. That can increase the vulnerability to the anxiety disorders.
Yeah.
Now, when
Yeah.
we're talking about the sympathetic nervous system, our SNS overactivation, okay, elevated catecholamines, remember, dopamine, norepinephrine, things like that, can lead to that prolonged sympathetic nervous system activation. It keeps you in that state, like I was saying, manifesting, persisting, that fight or
Mhm.
flight response, palpitations, difficulty calming down.
Yeah.
Okay. And what Dr. Kosterman was talking about, the worrier versus worrier. Worrier is when you have the clearance, fast clearance. Okay. So this would mean that you have a GG version
Mhm.
because you are not in that extended state of sensitivity, emotion, anxiety. It clears quickly. So it's more like on the up and go and
Yeah.
being ready and having that warrior mentality. You're not as scared of things, you're not as worried about them as compared to when they're hanging around and being in that state longer, like I had said, taking longer to recover from the stress, being in that heightened state of arousal. You tend to worry more,
Yeah.
you tend to stay within that state longer. So
Yeah.
that's where the balance is between those two.
Yeah. And so, audience, something to hear is you're kind of looking at your gene presentation and thinking, well, how can this inform me and how can this inform how I navigate the world? Right. So, I want to take a step back and instead of talking about the kind of um, addressment in the moment, hold on, I'm going to rephrase that. hear this hear this story that your genes are telling you of how you respond to your environment. Okay, so if you know that for your 5-HTT-LPR you got a bunch of S's, you know you're not necessarily going to have that
Mhm.
serotonin hug. That means when something stressful happens, you have to figure out other ways to self-soothe and calm down, because that's not going to naturally happen within your body in the way that it might within mine, because I have that access to serotonin, right? Hear that, if you're someone in that moment where something especially like loud and aggressive and scary happens, and you have that AG or that AA presentation of your COMT, right? It's going to take you a lot longer to come down off that high than someone with that GG presentation, right? And so that informs you that when those things happen, when those stresses or the big bangs happen, caring for yourself after the fact is excuse me, she's shedding a lot and I have a little bit of hair in my throat now. Um, Caring for yourself needs to be something as part of your self-care plans. They're not, unfortunately, a nice to have for those sorts of genetic presentations, but be mindful of that, because the moment those things happen to you and you create that space to recover and calm down, it kind of stops that cascade. It stops that cascade and that propagation of that stress and that activation of the nervous system. And it gives a little bit of space for you to shift how you're relating to it. Right. I hope that makes sense. Audience, I used to um, do a lunch and learn with a psychiatrist that I used to work quite closely with. And I remember at one point in time, I explained these genes and I was talking about, you have serotonin, you have COMT, and there's this like neurotransmitter cascade. And he paused me, and he was very wise in this. And he paused me and he said, you, you're talking as if, because, one second, audience. You're talking as if because people have this genetic predisposition that they're kind of a victim and beholden to this neurotransmitter, they're not going to feel calm. They're going to be anxious after the event. And in his mind and in his practice, and this was very true, knowing this gave the person awareness of how they would respond and gave them ability to pause and change how they support themselves in the moment so that it didn't propagate further into a bigger event, be that a nervous system event or that ruminative overthinking. So, audience, as you're hearing these things, identify with, oh, yeah, after something stressful, I don't feel calm, and be like, cool, that's an opportunity for me to find things to figure out how to calm myself down. Just a thought, just as you hear your genes, think through in the moment what can be done, additional to kind of that larger plan of how do we address the anxiety that so many of you, are here this evening and talking about having. Yeah.
And I want to drop a Justin bomb into this
Yes.
because I think it would be perfect. Yeah,
Yes,
because
please. Yes, ma'am.
I'm very sad that Justin was not able to join us,
We had
but
technical issues,
we
audience. Yeah.
have his wisdom to
Yeah.
impart. And one of the things that he has said was, you have the power over your mind, not outside events. Realize this and you will find strength.
Mhm.
So, even though, yes, you have the genetics, yes, you have this, you don't necessarily have to be victim to that. That works into a choice. But this is where education and information come in, that you go, oh, I have had so many clients that I've worked with, and they're like, that's why, I've done these things all my life, or that's why I think this way,
Mhm.
I react this way. And it's that knowledge
Yeah.
empowers them to go, hey, I now realize this. I can now decide, going, okay, genes, I know how you work, but you're not going to run everything. I
Yeah.
also,
Yeah.
have willpower and everything else, which actually brings up another thing that he says. And he said that it is not things themselves that disturb us, but our opinions about them. Thinking about the perspective, the lens
Mhm.
through which we are experiencing what is around us and what
Mhm.
is inside of us. So you do
Yeah.
have a decision in that. You have a decision,
Yeah.
maybe not in the initial emotions, but emotions are not logical. You can take a moment, taking
Yeah.
that space from an event to your response instead of
Mhm.
reacting,
Yeah.
taking a beat, that gives you that decision on how am I going to respond to this? Am I going
Yeah.
to allow this to overtake me and put me in, that
Yeah.
anxiety spiral?
Yeah. Which is important again, audience, why there's you work with a provider to really understand, is this anxiety or nervous system and kind of something else that might be inspiring the nervous system,
Mhm.
because the what you would do in response in between there is really going to shift. Yeah. All right. We have about 10 minutes before we want to transition to questions and answers. And I still, Dr. Varden, want to make sure we go through two really important genes when it comes to
Yes.
anxiety. So do you want to kick us off maybe on ADRA 2B, and then we'll close things up with BDNF?
Absolutely. So ADRA2B, which I've already given a little, clue into,
Hmm.
it has to do with the encoding of the alpha 2B adrenergic receptor. It's involved in regulating that norepinephrine release and the sympathetic nervous system tone. Okay, so all those, wonderful scientific jargon. Basically, what I was saying is that there's a receptor. Okay,
Hmm.
ADRA2B, the noradrenaline or the adrenaline receptor. All right, you've got the neurotransmitter floating around in that synaptic cleft. Remember, I said that it has to bind to that receptor, then it will exert its influence on the cell. So when adrenaline is floating around that synaptic cleft and it binds to the receptor, now your ADRA2B, you will see in your reports, there's going to be letters. There will be an I, ID, or a DD. Now, what
Hmm.
does this mean? This is an insertion or a deletion. Okay, so if it's I, it's inserted, D, it's deleted. And if the I is there, that means that it is working normally. So neurotransmitter binds and then it closes and kicks it out in order to be cleared and recycled. That would be an I. Okay. If you have a D with a deletion, when it binds, it doesn't want to kick it out very easily. So it keeps that
Hmm.
adrenaline in the receptor exerting its influence. Okay.
Hmm.
Which is that excitatory, nervous anxiety state. Okay.
Hmm.
So obviously, being aware of that,
Yeah.
you can know that's a biochemical reaction.
Hmm.
Okay. And, being able to, breathe through it or work with someone to help teach you tools and techniques on
Hmm.
how to work with and understand your genetics to work through that.
Yeah.
Not gonna, it's not like a tiger coming to eat me. A lot of times it's
Yeah.
just all the noises and beep beep, all the things your
Yeah.
brain does.
An audience, this will quite literally change the architecture of your brain. What do I mean? So, the amygdala is a part of our brain where we do a lot of memory storage, a lot of emotional storage. Okay. And it's highly, highly related to the experience of anxiety. I'm talking anxiety, and we're not talking nervous system right now.
Right.
Huge correlation between the amygdala and anxiety. When you have a deletion, especially when you have a double deletion of this, because of that extended hyperexcitation, you actually imprint more within your amygdala compared to those with the insertion, especially a double insertion. Okay.
She's talking about enhanced emotional memory.
Yeah. Yeah. So this means that if you are an ID, or especially if you're a DD, something happens to you, you're quite literally going to generate and create on a physical level within your amygdala that's very associated with anxiety. Okay. You're going to be in creating a bigger imprint. When there's a bigger imprint, it means you can access it more easily. It also means it's more salient to you when that memory is activated. Meaning the same thing can happen to two people. And if one's a DD, if they're ever reminded of it, they're going to feel it as if it was happening to them again. Whereas the II might have a little bit more of a distant relationship to it because that memory is there. They're sensitive to it, but not in the same way. So, audience, hear this again, that especially if you're someone who has gone through something traumatic and you have this a D floating around, especially a double D floating around, right? This will shift how brain is processing it, and how brain is accessing it after the fact. And again, this really speaks to that need for working with certain providers to shift how we're accessing and leveraging our brain. Yeah. Yeah. And I guess, Dr. Arden, do you want to jump on to BDNF? But I'd be remiss to say Wendy called out Webinar Kitty. And so thank you, Wendy. Cats are definitely shown, cats and I guess dogs, if we have to include them.
Yes,
Clearly, Dr.
I got
Varden and
my
I are
pup
on
right here.
Dr. Varden and I are on very different sides of the aisle when it comes to this. But pets are delightful things and agents in mental health, especially Webinar Kitty. We have Webinar Puppy back there somewhere too. But let's
Yes,
jump into BDNF next.
absolutely. And you can get another drink of water.
There's so much
So,
hair.
BDNF. This stands for brain-derived neurotrophic factor. It supports neuronal growth, synaptic plasticity, that brain plasticity, stress resilience, and it can influence ruminations. Now, what do I mean by that? Now, first of all, BDNF, you will see in your reports, you will either see a GG, a GA, or an AA. GG is considered optimal, your wild type. Okay. And this is where you will have, optimal, efficient regrowth of neurons, as well as, what fires together, wires together. Or people, this is what's very helpful to know in children, even for sports. If they get a head injury, it's much more helpful if they have a GG version, because they can recover a bit more readily. But in any case, when we're talking about having an AG or an AA, this is where it's a little bit slower in that connection. Okay. And when BDNF is suboptimal, and I'm gonna put in a little kicker here. BDNF, you can have a GG version, but it can act suboptimally.
Yeah.
I know, mine does. But so I have a GG version, but if you look at your TPH2, we're not going to dive deep into TPH2 today, but it's important for BDNF understanding. If you have the optimal version of TPH2, which is the GG version, okay, TPH2 works with serotonin production. It actually will cause BDNF to act suboptimally. This is called an epistatic effect. So how the relationship of how one gene is will affect the way another gene acts, or will produce the particular protein that gene is coding for. So being aware of the nuances of how this works. So with BDNF, how this works into the ruminations, like I was talking about. So first of all, let's mention, I don't want to forego the anxiety aspect. So when you have the reduced activity, so an A, for anxiety, it's associated with increased risk of anxiety itself, of mood disorders, greater stress sensitivity, altered hippocampal function. It can also contribute to impaired stress adaptation. Remember, what fires together, wires together, and that resiliency, and also can affect emotional regulation. That's where we can get into some ruminations. But also when we're talking about the SNS overactivation, when it is impaired or not acting optimally, that signaling can reduce the neuroplasticity, the resilience, making that brain more vulnerable to chronic overactivation and prolonged stress responses. But when we're talking about ruminations, this is where your head will start spinning. And when you start shutting everything down, when your head hits the pillow and everything is quiet, brain, that monkey brain, that chatter doesn't want to stop. And you're thinking about, oh, that conversation I had with my coworker or my husband. And you start just running through everything and just, making it bigger than it is, which is another Justin bomb of we suffer more in imagination than in reality. Okay.
Yeah. Yeah.
So I know you've got some filler information when it comes to BDNF and the ruminations.
Yeah. Yeah, no, I think this at least, when I work with people through mental health, this tends to be one of the, especially when you couple it with your address, so the gene that we were just talking about where you imprint, this can really speak to people that really do struggle with anxiety and those repetitive thought patterns. Because if you have a D hanging around in your ADRA 2B and you
Mhm.
imprint those memories more, and then also you have this experience with BDNF where you're more prone to spinning over things, it sets you up. I don't want to say it sets you up for failure. It doesn't, but it sets you up in a way that makes you more prone to anxiety and thereby really requires you to kind of identify that and have tools to prevent that, right? Be it tools you've created yourself or working with a provider for. And I think it's really, really helpful to remember again, this is how your brain is set up. And so that doesn't mean it's a failing on you because you can't get control of your mind, right? Like, I don't think it's fair to tell people you can think your way out of anxiety. There's a lot that needs to be done in diet and lifestyle, and there's a lot that can be done with thought and therapist work, right? And body work, somatic work, that can shift this. But remember, having that kind of, it sets you up in a tricky place, but knowing this then empowers you with how you can work with it, which becomes really, really important, audience, because you can work with it. There's supplemental agents, there's pharmaceutical agents, all of these things. There's a lot of behavioral and somatic therapies that can bring you out of this. And will you always be sensitive? Sure. But that's also a really beautiful thing, audience. I mean this sincerely. Those with the deletions and those with suboptimal BDNF tend to be some of the more beautiful, sensitive souls, the artists, if you will, of our world. And so while it does come with this tricky double-edged sword of you do have to do a little bit more to support, insulate, and nurture yourself, there's also an innate tendency to see the beautiful and the sensitivities within the world as well. So again, remember, audience, there's both sides of this. All right. Medell, I think it's time we jump into our questions and answers because we have quite a few.
Yes, yes, we
Yeah.
do.
Yeah. And so I will proactively say, I think, Dr. Varden, if we want, maybe we're not going to name people this evening,
Okay.
just to ensure privacy, because I think it was only partway through that I was like, let's not name people. So, audience,
Gotcha.
we won't be offering names this evening, but we are going to run through the questions now. So our first question is from a person. It's going to take a beat for me to remember. My sympathetic nervous system has contributed to severe gut dysbiosis. This person used a vagal nerve stimulator because it was recommended. They bought it. They didn't feel any improvement. Do you have any opinion on these devices? If they do work, when and where appropriate, etc. Yeah. Um, so, just audience for a little bit of context here. Um, Mind and gut exceptionally well connected. If there's something going on funky on in the gut, there's probably something funky going on in the mind. And that's something we haven't really talked about this evening, but very, very important. We've done a few webinars on the gut brain connection. So, Vanny, maybe if you want to toss in that link so the audience can see it. But one way that this person was recommended is it's an electronic device. You kind of place it in and around vagus nerve, which it descends around here. So you quite literally strap it onto your neck. It delivers electrical impulses, for lack of better physical electric phrasing, and it has been studied to support stimulate this nerve, which is very calming to body, to gut. So this person is saying didn't help them. Dr. Varden, you might be better read on the statistics, but this I would call a techceutical. So instead of a nutraceutical or a pharmaceutical, a techceutical, there's strong evidence behind it being supportive. This said you need to ensure you have a proper device and separately also diagnosed properly. So possibly it was a inappropriate diagnosis or inappropriate support. Dr. Varden, do you have any other thoughts? Because I know you're a huge fan of these devices as well.
Oh, absolutely. I mean, there could be some user error in there. I mean, not, I don't, I'm taking that, hypothetical. So don't take this as oh, you did it wrong. No, I'm just saying, going through all the troubleshooting steps. It could be placement and technique, because not all devices stimulate the correct vagal branches effectively. So, there could be some placement. Okay. The stimulation parameters, if the frequency or the pulse isn't matched to clinically validated protocols, it's like, depending on which device, there are knockoffs, there are better ones, that it may be too weak or ineffective, because, for example, like a typical hertz range for mood and regulation, it's like 20 to 25 hertz. Anti-inflammatory digestive effects is more like, I think, 1 to 10 hertz, things like that. So, knowing the frequency of it. Even duration and consistency. Vagal training is not immediate. It can take time. It can take a few weeks, and daily use, often, sometimes even twice a day. This is something where working with someone, not just saying, hey, get this, but how to use it. Because sometimes it does take more consistency to see or to feel any measurable effects. It could have been too much too soon, even. Overstimulation or using it while still in a high sympathetic state can actually paradoxically make it feel worse. It can really best be paired, multimodal approach, okay, with some relaxation techniques, deep breathing, humming, low light exposure, even doing like yoga nidra, other types of techniques to get that more calming state. And of course, there's also times like, it's probably best to use it before meals, prepare that gut for digestion, maybe upon waking, before bed, things like that. So that's where I would, kind of troubleshoot, because I do
Beautiful.
really like it.
Gorgeous. Yeah. And again, audience, I think nervous system when I think that. And so can it be used as a tool for anxiety? Sure. But it very much for nervous system overactivation.
Right.
Yeah. All right. Our next question is actually more a comment, and I just want to offer it because I think it's worth saying. Could there be more research or attention paid to anxiety that might skew the numbers for higher presentation now compared to in the past? So really saying, like, at the top of this webinar, we talked about how the rates have been going up. And I would say yes and no. I think of late, we're starting to see more anxious symptoms being reported and a shift in numbers post-pandemic. And there's probably a lot of these things feeding into that. We've shifted a lot as a society based on technology, based on what we're aware of going on and around the world. But I think this person is also making a really strong point that we weren't studying anxiety 100 years ago. So of course the numbers have gone up, because as education goes up, as studying goes up, so will numbers. So I would offer there's probably both truths that are going on there. Yeah. All right. Our next question. Uh, okay. So their daughter never seemed to have anxiety as a child, but now they're constantly using the word overstimulated. This daughter is extra sensitive to all sensory input in those moments when they feel overstimulated, and has a hard time functioning. Is this possibly the nervous system response and not anxiety? Um, if you're still here, I'd love to know how old your daughter is, because that will really, really play into our reply. Yeah. What I will offer is um uh, okay, they're okay, so this person has said that they're 23. Okay, so they're just leaving kind of adolescence. Females tend to leave adolescence and a lot of that hormonal disruption different times, and so I would say for this person there's a few things in the play. Hormones, just coming out of adolescence, there's a bit more stability. That said, this can be a period where you're starting to see hormonal fluctuations, which can play into this. Um, there's also going to be an element of they've now been launched, and there's more than before. There's also an element of technology. There's many different elements, and so I would say it'd be remiss for me to be like, it's anxiety or not, it's this or not. You really would want to bring them to a provider. Um, and because you would want that provider to assess not only the psychology of them, but also the nervous system. There are surveys that can be done from a nervous system perspective alongside blood work that can really give that full view of the person to really understand what is going on and creating either a nervous system that is hypersensitive to the environment or mental conditions that make them hypersensitive to the environment. Um, Dr. Varden, do you have any other thoughts there? Any kind of considerations that I might have missed?
Well, being at that age and using the vocabulary that she is,
Yeah.
to me, I would uh, associate overstimulated is often code for too much input, too little regulation.
Mm-hmm.
And, a lot of this, does work into that sensory processing sensitivity. Okay.
Mm-hmm.
So yeah, I do concur with what you are talking about, and thankfully there are ways that things that can be done, some of the things that we had talked about that can help with that
Yeah.
retraining,
Yeah.
that recognition and retraining. So,
Mm-hmm. Yeah. Yeah. Absolutely. Yeah.
yeah,
So don't hesitate to reach out to us for some of that support because we don't want to leave you with a vague answer. But we wouldn't be doing you a favor by pretending to have an answer with such little information. Yeah.
right.
All right, the next question is, any practical suggestions that can help with obsessive compulsive disorder patterns? So that is, I guess, kind of within the umbrella of anxiety. Um, I would offer not, I think there's a lot of questions that we need to get through, and I want to stay specific to anxiety. But I'm grateful that you asked this, and I wonder maybe in the future that we do an episode on this, and I will proactively advertise it insofar as we have an in-house specialist, excuse me, our associate dean of the DNAU who focuses in this pattern, the space of disorders. And so I wonder if we get her in there so that we can have a more meaningful conversation for you. Please do reach out to us. We'll make sure that we personally email you with when we do that webinar. But I wouldn't want to shortchange this answer here. I think genes have a lot to say with it. And I really, really want Dr. Crawford's input because she works in a hospital that's very specific to this patterning. Yeah. Yeah. And Dr. Varden, I know you two get on so well in your work with DNAU.
Yes. And actually, it works off of the second question from the same person,
Mm-hmm.
being specific in that if someone has a fear of driving through expressways,
Mm.
these suggestions. So this is, very particular. And I mean, yes,
Yeah.
there are things that can be done, but there's also the need of knowing what everything is going on. Again, doing a multimodal approach, but also working into specifically someone working with you. It's not just saying, here, try this, you know, but to be supportive in that process, troubleshooting and going through, you know, techniques that have been shown, based techniques that can be implemented, and also working with cognitive shifts, maybe even targeted supplementation, leaning into that neuroplasticity rewiring.
Mm-hmm. Yeah. All right. Um, our next question is oh, I love this question and actually touches on something that we haven't touched on yet. So I'm very grateful to the person that's asked this. I often feel anxiety after a meal. What gut issues, if any, can cause anxiety? And do you have suggestions on how to diagnose the problem? Yeah. So especially audience, when we said there's a huge overlap of diet and lifestyle that really will lend into experience of anxiety, kind of that emotion, that feeling of anxiety. Meals and diet really play into this. Why is that? Um, so especially if you have a meal that takes you out of your baseline. So if you have a super, super, super sugary meal and you spike your glucose, eventually all things that go up must come down, gravitational rule. It means that drop, your brain is trying to make sense of what happens because your brain, like it or not, as healthy as change is for your brain really likes things to be stable. And so the moment you deviate from that stability, your brain doesn't have a lot of language to understand what's going on. And so, in response to that, you'll actually feel very anxious. So, oftentimes, um, it can be a change of blood glucose. Okay. So, really working to stabilize blood glucose, especially for those that are either side anxiety or sympathetic system overdrive, is really important. Dr. Varden, do you want to talk about the gut biome and how that influences serotonin and all of the things that, yeah, because blood sugar is a really important part, audience, especially if you have certain genes that influence that. But so is the world that is within your gut. Do you want to talk to that?
Absolutely. I mean, when you're talking about the fermentation of food in the small
Mhm.
intestines, okay, if there is any dysbiosis or imbalance with the keystone species as compared to any pathogenic species, you know, uh, things like small intestinal bacterial overgrowth, SIBO, okay, producing gas like hydrogen methane that can distend the gut, irritate the vagus nerve, spike cortisol. These types of things can cause brain fog, panic, racing heart after eating, especially after eating things like high sugar foods, carbs, things like that. Um, the There's testing that you can do, gut testing, to see what is your current population, where might you be balanced and balanced. And we have a fantastic test for that. We have our
Mhm.
DNA Gut 360 premium test.
Yeah.
Not just that, but also lipopolysaccharides. These are parts and metabolites that are created from certain pathogenic species, and that can cause intestinal permeability, leaky gut, inflammation, increasing inflammation and inflammatory particles that can get into your circulation. This can trigger neuroinflammation that can lead to that post-meal mood crash or anxiety surges. One of the things that you can actually test if you are even slightly sensitive to food, if your heart rate increases 10 beats or more, like you can put food in your mouth, let it sit there, for a few seconds, or like within, a minute or so of eating it. If your heart rate increases and you haven't gotten up and walked around, then you have a slight sensitivity to it. That's a quick and dirty way of going, hey, how am I reacting? But I mean, there's also the fact of sluggish bile, gallbladder dysfunction. If and this gets into how can you tell, what can you know on some of these things. If you have poor bile flow, that means fats aren't being digested well. This can cause nausea, pressure under the ribs, bloating, feeling off, anxious, fatigued after fatty meals.
Mhm.
So there are certain things that you can test and look at. But honestly, guys, when you eat, you should be shifting into a parasympathetic, that rest and digestive state. So if you're stuck in the fight or flight, due to traumas, mold exposures, toxins, chronic stress, things like that, then it makes digestion really inefficient and can cause that anxiety after meals due to that poor gut signaling, gut to brain. So
Mhm.
and again, there's several different tests that you can do. You can test
Yeah.
your glucose through CGMs. You can, see, if you're higher in histamines, you can do a SIBO breath test. You can do that, like the functional stool test. And one good thing, start tracking your symptoms with your food. Just do a food journal. Food, mood, poop. There you go.
Yeah. Yeah.
All right, we've got a lot more questions, so.
Yeah. Yeah. Audience, I think Dr. Varden offered a lot of wisdom there because there's so much that can be done simply knowing gut and then intervening appropriately. So test, don't test. Um, Our next question is saying, regarding sympathetic nervous system overactivation, can you speak to non-epileptic non-epileptic seizures? They're saying from personal experience, these are very different from panic attacks and difficult to calm down without medication. Um, However, they are treated the same. So what non-epileptic seizures are is seizures often are you will have convulsions or unresponsiveness or something, a physical collapse, and it's associated with a change in brain activity. For those that are non-epileptic, it means there's no you're still having the same response, that convulsion, that non-responsiveness, whatever it might be, but there's not accompanied by the shift in electrical activity. I would be remiss to say if I would know how to approach that differently. I don't think we have genes that speak to that, and I'd really want you to be engaged in a more wholesome clinical consult, because I would speculate there might be something in the history there that can guide that. So if you'd want to reach out to us, please do let us know, because we can connect you with a practitioner that would be well suited to do that. But I don't, unfortunately, have any off the top of my head webinar advice here. Yeah. All right. The next question we have, so this is the person is asking, where within the reports they can find some of the genes. And so this might be a little bit of a latent comment. But I guess if you're going, and actually maybe I'll defer to my SS here if you want to tell the audience how to navigate to the system summary.
So when you open up and click on mood and behavior, you'll get all the subreports. System summary is one of them. It has a purple, cute little Asian girl, short hair, and it says system summary. So click on that.
You're
That'll
such an SS. I love it.
And then there's other subreports specifically about addiction, ADHD, anxiety, burnout, empathetic versus logical behavior, irritation and frustration, procrastination. And I think there's one more, thinking patterns and neurotic tendencies. There we go. So just go through there and just take a look at the different things that you see, but really you could just look at the system summary to get started. There you go.
Audience, that is SS in all its glory.
I really try to.
Okay. The next question here I value, and I'll offer a quick anecdote for it. So the person's asking if your genes are optimal, but they don't reflect your reality. That happens a lot. There is, when it comes to nervous system overactivation and anxiety, it's not like there's no one gene, nor are genes destiny, meaning if you have good genes, then it means you're not going to have that. I think the easiest example that we can offer here is in terms of diabetes. So we have a few genes that can influence how you metabolize and use your sugar from your diet. We have a few genes that really influence insulin secretion and sensitivity. If you have optimal genes for this, you can still get diabetes. You can do that by eating a horrible, horrible diet. Really, what the genes inform there is effectively how quickly you're going to be getting type 2 diabetes. They don't tell you whether you can get it or not. Okay. So when it comes to kind of a great profile, does it mean you can't get anxiety or depression? Absolutely not. It just kind of shifts the likelihood and shifts the why behind it. Maybe it's more of a gut source. Maybe it's from hormones. Maybe it's from a different cause that aren't necessarily neurotransmitters. But hear me when I say genes don't mean you can't get something. It just shifts your favors and might shift how long it comes in. Again, that diabetes example kind of being the most obvious. So if you're looking at your report and you're like, gosh, darn it, the gods blessed me and my genes are perfect, but I still feel like crap, that either means something else is amiss within the body, or there's circumstances within life in the present moment or in the past that have shifted that. So I'd really encourage, especially if you're seeing good genes and it doesn't feel like your experience, working with a provider to figure out what that delta is. Yeah. Dr. Varden, do you want to? All right. So, oops. Oh, mon Dieu. Oh, mon Dieu. We're trying, audience. The next question is, how do I get over trauma? And then they specified this to say a passive aggressive mother who said really horrible things. Um, uh, and yeah, and so this person's also emphasizing that from a genetic perspective, they're suboptimal in their BDNF. Um, and so they're really saying they kind of have this traumatic past, um, and what can be done there to support this. Yeah.
Now
So,
there's
yeah,
a few
please.
things because I have dealt with many clients like this and for myself. I mean, even though I have a little bit different genetic presentation, but it still works into suboptimal acting BDNF and ruminations and things like that. But there is a fantastic book that I highly encourage you to pick up, listen, read, and it's called The Tools by Doctors Barry Michaels, that's Michels, and Phil Stutz, Stutz. Incredible resource of having to deal and work through and understand, you know, traumas that you have dealt with in your situations here. There's also a documentary on Dr. Phil Stutz called Stutz by Jonah Hill, the actor. And it just starting there, watch the documentary first and then dive into the book. It's wonderful.
Mhm.
On another multimodal type aspect, there are things that you want to do to help upregulate BDNF, to help upregulate serotonin, because TPH2 works with serotonin production. So getting out in the sun, getting sunlight in your eyes within that first hour of waking up, exercise, um, doing things like uh, different types of supplementation. And I mean, this is where I would actually work with someone, to formulate a more personalized way of doing this. But getting out in the sun, everybody should do. Exercising, everybody should do.
Mhm.
So also another thing is at night when the ruminations start, have a notepad or some sort of book by the side of your bed. Write these things down, get them out of your head and onto a piece of paper. That really helps. And prayer, some sort of meditation to whomever higher power that you subscribe to.
Mhm.
You don't have to carry all the weight, and not
Mhm.
everything is your responsibility. So
Yeah.
having that is extremely helpful.
Yeah. And if it's within your means, I would also really encourage working with a trauma-informed therapist. Um, our scientific and clinical awareness of how trauma impacts brain and body is has expanded by leaps and bounds over the past several decades. And so there are therapists that work specifically with trauma and starting to decouple that from the experience. And it's very, very possible. So if it's within your means, I'd also really encourage working with someone who's trauma informed and can help that, because there's a lot of somatic, meaning body, as well as mind things. And it tends to be, especially with trauma, a lot of somatic work that needs to be done.
Yeah.
Yeah.
And speaking of which, EFT, emotional freedom
Mm.
technique,
Hmm.
tapping,
Yeah.
re-regulating
It's
the
a
nervous
great free
system.
resource. Yeah.
Yes.
Yeah.
Okay. And there's some
Great free
great,
resource.
absolutely. And actually, what we just talked about answers one of our other questions. So we can probably, which was
Yeah.
what do you suggest handling the GG
Yeah.
versions of both BDNF and
Yeah.
TPH2? Well, it's actually the same way
Yeah.
of, the form that I was just talking about
Hmm.
answering. So
Look at you being psychic. I love it. All right. Our last question actually speaks to the same in the sense that this person ruminates a lot. They hold grudges. They're easily irritated, monkey mind chatter, poor sleep, um, anything that we would suggest. um, I think you're kind of that perfect candidate of definitely. I, I don't mean to say this to be dismissive, but at least have one appointment with a provider to really categorize and assess how significant this is, because we would be not doing you a service if we were like, go with diet and lifestyle and completely neglected something that really needed intervention. So get at least one assessment with a provider.
Mhm.
Um, and then separate to that, really, I think between anxiety and between the nervous system activation, we mentioned that a lot of diet and lifestyles things can be done to calm body down and support both, right? And so really working on diet, right? Especially that blood sugar regulation, that really will help some of the stress the brain needs to manage with, right? Understanding how gut is, understanding nourishing properly body, right? It's incredible that there was a study done that looked at just giving people with anxiety 300, I think it was 300 milligrams of magnesium, quelled symptoms for them, meaning some of that anxiety was simply related to a magnesium deficiency. And so ensuring your diet is on point becomes really, really important, because sometimes, not all the times, sometimes a lot of the symptom picture, that irritability, that inability to calm down, is simply just a lacking within diet and body's inability to have the tools and resources to calm self down. Okay. So working with someone to really assess diet there, sleep, 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 and exercise. We don't, I want to be respectful of the time that we don't have left, but those sorts of things, very important. From a sleep perspective, you can induce anxiety, depression, and a few other conditions simply by not sleeping well. So working on your sleep, sleep hygiene, etc., that will reduce experiences of it. May not cure it, but it might get you in a better place where you can start working better with it. Yeah. And then exercise, because exercise, love it or not, fixes everything. Yeah.
Well, the difference between hope and despair is a good night's sleep.
Look at you and your, that was a Lauraism, wasn't it? Look at you. Justin doesn't show up, and so Laura carries us through. I adore this. Thank you so very much, Medell.
And I do want to plug something, because there was a book that I read recently, Dave Asprey's new book, Heavily Meditated. Really, it reframes anxiety, emotional turmoil,
Hmm.
not as failures of willpower or logic, but as symptoms of dysregulation in the nervous system, any energy efficient, deficient brain,
Hmm.
and really dives into different ways of, biohacking, breath work,
Mm.
neuromodulation, really data driven, very interesting. I enjoyed it. I took away some great pearls.
Mm.
So anyway, it really is a way to say, to give you a big hug,
Mm.
to empower you. So
Yeah.
anyway, just a recent book that I read
Yeah.
that I
Yeah.
liked and
Love
wanted to share.
that. Yeah. Before we kind of start our adieus, um, someone did offer feedback in regards to names being visible, and I did not realize that. So thank you very much for the feedback. We as a team will work towards how can we create a space where you can offer an anonymous question. Um, yeah, so thank you for that feedback, and apologies that we weren't able to offer that safe space in advance of then. So, thank you for your patience there. Dr. Varden, we covered a lot tonight. I'm very grateful to
Yes,
have
we
covered
did.
it. This is our triple header, sports,
Yeah.
and I'm very
Actually,
grateful.
almost quadruple, because I sat in on the long COVID
Oh yeah. Oh mon Dieu,
talk
it's
on
been four
Monday.
times this week.
Yeah.
Girl. All right. Now it's time for us to
Doing
take a
late
break
nights.
and calm down our nervous systems. And audience, thank you so very much for being here with us this evening. It's been such a beautifully interactive session, in particular given the subject matter and how tender it might be. And I'm grateful. I hope that we offered some insight, be it for yourself or loved ones. Dr. Varden, as always, I love that you show up with books, and I love that you show up with, here's a free thing.
Yes. We
I
love
really
free
value.
things.
Yeah, yeah, yeah. So, audience, we're with you. If there's anything that you need support on, please do not hesitate to reach out. Our CEO will quite literally respond to you day or night. So just shoot us a line at ceo@thednacompany.com. We can connect you with a provider. We can connect you with additional supports. We're here to support you. That's why we show up. And to that end, audience, we didn't talk about it, but dancing is one of the best exercises you can be doing for your mental health. So Dr. Varden and I are going to dance out. All right. Au
Thank
revoir.
you so much, Dr. Kosterman, and thank you everyone for joining us. We love
Mhm.
you.
Au revoir. Merci, Dr. Varden. Au revoir.